Thank you, Dr. Ramparveshwar sir. Thank you, Dr. Neha. And thank you, Dr. Arpit and the whole Hindi team. Now we are moving to our English session. Today is our 2133rd day of continuous webinar. Thank you all the participants and faculties for joining with us and giving your supporting hand to us. Thank you so much. And today our speaker is Dr. Viren Nimbark. He is MD in Homeopathy and Professor in the Department of Surgery in Rajkot Homeopathic Medical College, Parul University. We are so happy to get you as a speaker of today. Today's our topic is Homeopathic Management of Tonsillitis. Thank you, Dr. Viren. You are most welcome to Ifph Forum. Please, you can start now. Doctor? Oh. Yeah, you are the co-host now. Please.
Okay. Am I audible?
Yes, audible.
Good evening, ma'am. Good evening, Ramprakash sir, Ganesh sir, Dr. Amarthakur sir, Dr. B. Prasad Panda.
You're audible, but can you please increase the volume of your computer?
Okay. Am I audible now? Okay.
Yes.
Okay. So, as for the International Forum for Promoting Homeopathy, these all webinars are very much fruitful for the particular more and more awareness regarding the homeopathy. My topic is also related to the more required awareness, as we all know that in the prior conditions, the tonsils are also one of the major organ which is majorly dissected. Okay, tonsils in which are majorly having the infection, recurrent infection, and because of that, it is getting many times removed in the childhood or the early adulthood. So then further on, it will cause more and more difficulty for the immune response for that person, and then it will be more difficult for the person to sustain all further on infection. So homeopathy is also very much useful for the tonsillitis. It is also very much useful for such infectious condition and recurrent as well as the chronic infection of the tonsils. So that we will discuss in today's webinar. So probably my presentation is visible. Hello, ma'am. Could you please confirm, is it visible?
Yes, visible.
Okay, so the acute and chronic tonsillitis, both are quite a different thing. Acute tonsillitis majorly for 2 to 3 days, and then it is also mostly recovered along with the medication or it on its own. Otherwise, it will go further on more infectious conditions. There is chronic tonsillitis, or it will be also causing the peritonsillar abscess, that is also known as quinsy. Adenitis, that is also another condition. We will also try to discuss all those conditions one by one. Okay, so the particularly tonsils are the lymphoid tissue near the entrance of the digestive and respiratory tract. That is the aggregate position near the entrance of the digestive and respiratory tract. They are also the gatekeepers of the immune system. As we know that there are few systems or the orifices which are connected to the external environment, like digestive tract through the mouth, respiratory tract through the nose. There are also few other orifices, but these two tracts which are directly concerned along with, and they are also working physiologically to maintain the metabolic condition or the nutrition for the body. But whenever there is the connection from the external environment, it is causing the external pathogens, external conditions which are also harmful to the internal environment, that is to our body. And to prevent such conditions, tonsils are also the major useful organs. Those are the gatekeepers of the immune system. Tonsils are two oval-shaped tissue pads located on each side of the back of the throat. They are the body's primary defense mechanism against the inhaled or ingested pathogens. So it will capture the bacteria as well as it will also capture the viruses or the it will also remember those bacteria and viruses, and for the further on infection it will be very much helpful, that we will also discuss. Whenever the infection is highest in the childhood, it is also developing the memory of those infections, such like whenever the bacteria will enter, it is like the B lymphocyte that will develop the memory cells, and then further on, whenever such same bacteria or similar bacteria will causing the infection, it will immediately attack attack back. So it is also useful. It is also useful. It is helpful, like that gatekeeper role. Okay, tonsils are also the structures initiating the first immunological response. Like likewise, okay, there are few different types of the tonsil. Okay, majorly the tonsils which are considered by us or the layman, that is the palatine tonsil. There are also the another location of the tonsil or the lymphoid tissue which are situated just starting from the inner portion of the nose, that is the starting from the nasopharyngeal portion. The adenoid is situated over nasopharyngeal portion, that is known as pharyngeal tonsil. So it will be very much helpful whenever there is any infection which enter through the respiration, and it will be also helpful for further on remembrance of that infection as well as for the any any future infection through the respiratory tract. Then the second tonsil, that is palatine tonsil, it is situated just next to the oropharynx or between the oropharynx and soft palate. And the third part of the tonsil, that is situated just at the base of the tongue or the posterior one third of the tongue, that is known as lingual tonsil. Okay. I have also searched one 3D module for the same. Okay. So in this 3D module, you could see that adenoid tonsil, that is the upmost, which is directly situated just at the end of the nasal mucosa. So thus it will be useful to help the defense mechanism which is along with the respiratory tract. Then the second tonsil, which are situated over the both sides of the mouth, that is the palatine tonsil. It is useful for the any ingested bacteria or viruses. The same is also useful for along with the lingual tonsil here, that is situated at the base of the tongue. These 3 to 4 lymphoid tissue, that is also the tubal tonsil, which is situated in between the adenoid and the tonsil. Okay. Palatine tonsil and adenoid. Okay. This all structure are forming a ring-like structure that is mostly the vulnerable for the any kind of the infection, and that's why it is known as the Waldier's ring. This structure is known as Waldier's ring. It is forming the particular portion for uh, almost in almost blocking any kind of the infection, either it is from the respiration or it is from the mouth. It is blocking any kind of the infection to enter further on inside the body. So it is very much helpful, and that is the major role of the tonsil. Physiological role, that is the Valdier ring. These ovoid lymphoid masses protect the aerodigestive tract. They are the largest in the childhood because in childhood, majorly the B lymphocyte is developing the memory. Memory cells are developed inside the B lymphocyte that will be further on useful for more and more development of the M cells. Those are situated over the surface of tonsil. So this is the lymphoid tissue of the tonsil. In the lymphoid tissue of the tonsil, it is having B lymphocytes. Those B lymphocytes is developing the IgG. Majorly this that immunoglobulin that is being the memorized for that particular infection each and every time. There are major thousands or lakhs of the bacteria and viruses that will be entering through the respiration as well as through the ingestion that is getting captured through this crypta magna. The structure is very similar to the pear species. Crypta magna and the primary crypt are useful for the capturing of any kind of the bacteria and viruses. By capturing it, it is developing the secondary crypt, that is having the reaction over that particular ingested bacteria or viruses. So then further on, it is also useful for developing that B lymphocyte throughout the circulation. So that's why the circulation of the tonsil is also very much important. Medial surface is covered by the non-keratinizing stratified squamous epithelium that is deep into the lymphoid tissue to form the 12 to 15 primary crypts. It is developed from the medial surface, and the lateral surface that is getting just next to the muscle. Okay. So the muscular bed and drainage. Structural bed that is getting formed by the superior constrictor and styloglossus muscle. Superior pharyngeal constrictor muscle that is causing the structural bed to the tonsils, that is palatine tonsils. And the glossopharyngeal nerve is also lies in the close relation to the lower tonsillar fossa. So that we will also discuss while discussing tonsillectomy, that it is used, it is very much getting uh, to have the glossopharyngeal nerve as well as the uh, internal carotid nerve not to be cut because they are very nearby structures to the tonsil. For the arterial supply, the tonsillar branch of the facial artery, that is the primary blood supply to the tonsil, that will be entered through the lower pole. For the arterial supply, we will also again go to the 3D diagram. I hope this is also visualized. Hello.
Yes, sir. Yes.
Okay. So the tonsillar branch from the internal carotid artery, that is the main branch to the palatine tonsil, as well as it will also goes up to the adenoid tonsil. And there are also the uh, two different other branches, that is from the right ascending pharyngeal artery that will supplying over the palatine tonsil as well as the lingual tonsil. Okay, here they missed the lingual tonsil. Lingual tonsil is just situated over here at the base of the tongue, just after the oropharynx. Okay, so the lingual tonsil is also supplied, and this arterial supply is very much useful.
Dr. Viren?
Yes, ma'am.
You're showing the slide, the palatine tonsils act as sentinels. That slide, right?
Okay, so the 3D diagram isn't getting shown. Okay, I need to.
Are you moving? I think.
Okay, I will share differently, so it will also show.
Okay.
Okay, so probably now that 3D diagram is showing.
No, yeah. Now
Is it?
start. Yeah, visible.
Yeah, so I have also discussed about this 3D diagram prior. That the
Okay, sir, you can.
so yes, thanks. So here, this is the Valdier range, which is also situated just posterior to the respiratory tract, which is also from the nostrils, and it will be also causing the any infection which will enter through the respiratory tract, and it is also preventing any infection through the uh, ingestion. And so this particular portion that is having the major portion of the lymphoid tissue, and it is the primary gatekeeper for the all both system. Okay, that is respiratory as well as the digestive system, as the adenoid tonsil, which is situated over just beneath uh, or the posterior nerve over the nasopharynx. It is useful for the prevention of the any respiratory infection. Then the palatine tonsil, which are situated just next to the pharyngeal arch, and uvula nearby to the uvula, that is useful for the prevention of any infection through the digestion or ingestion. And the lingual tonsil, that is situated posterior to the uh, posterior one third of the tongue. Okay, so uh, that structure is very much useful. That I have also discussed. Now the arterial supply of this all parts that we have also discussed. Further on, the crypta magna is the basic structure which is useful to get to capture any kind of the infection inside the primary crypt, and then it will develop over the secondary crypt, which will be also secondary crypts are also the branch from the main crypt, acting as a natural trap for the epithelial cell, bacteria, or any food debris. That will also memorize it by developing the antigen G. Okay, so that's why it is known as the sentinels. Sentinels are particularly the gatekeepers, which are preventing any threat to enter. Okay, so the palatine tonsils, which are functioning as the primary sentinels at the portal of the air and food passages, forming a critical component of the Valdier link, and that is also the major mass of the lymphoid tissue. Uh, like other lymphoid tissues, the tonsils contribute to the immune defense to responding to infection and foreign antigen. So tonsils are located at the respiratory and digestive junctions. They will also initiate the lymphokine and immunoglobulin production in the same response. Likewise, it is responded as the antigen antibody reaction. Whenever the composed primary, it is composed with the B cell. The lymphoid tissue of the tonsil is composed of the B cell, and that will be also supported by the specialized antigen capturing cells, which are known as M cells or the mast cells, which are present on the tonsillar surface, and that will also facilitate the uptake of the microbial antigen. So that's why it is also developing more and more during the childhood. So it is also having the highest peak at the childhood. The activated B cells proliferate within the germinal centers of the tonsil, where the memory B cells here. So activated B cells will be entering inside the germinated germinal centers of the tonsil, where the memory B cells mature and are retained for the future exposure. Those B cells are also producing immunoglobulin A, which is the antibody for the mucosal immunity. The cellular architecture of the tonsil closely resembles the pair species that we have discussed. The lymphoid tissue of the upper aerodigestive tract, forming the Welder's ring, which is useful for the prevention of such infection. Okay. Structural advantages, it is having the deep crypt which increases the surface area for the contact with the foreign substances and pathogens. Tissues gradually diminish and atrophy over the immune system and the clinical threshold. Whenever the tonsils are almost functionally inactive, or it is also causing the permanent seat of the disease or the infection, it is required to be removed. Otherwise, many a times the homeopathic medicines will also recover such condition even, and then it will be also further on more useful for the patient. Majorly, the tonsils are infected with the streptococcal infection or the staphylococcal infection. If there is infection of the gram-negative bacteria, then it will causing the major condition. Primary etiology, it is getting infected from the hemolytic streptococcus, which is mostly in the school-age children. After the infection, there is acute immune response as the uh, suffix itis, that means there is the inflammatory response. So the all the condition of the inflammation along with the odynophagia, that is causing the refusal of the food, that the child will stop taking food. They are also having the pain over the swallowing, that is very much aching and sore tender pain over the swallowing or even drinking. There is also the bad odor from the mouth as well as the from the breathing. It is also showing the coated tongue. There is also the coating, that we will also see the pictures of the patient, that coating over the tonsils. That is also the different. There are also the different types of the tonsillitis. That is the follicular tonsillitis, or it is also showing. I have also the same. Yes. So the acute catarrhal tonsillitis, that is only the superficial and the viral involvement. Tonsillitis present as a part of the generalized pharyngitis. There isn't particular more infection which is seen over the uh, tonsil, but rather than it is showing as the pharyngitis continuous along with the tonsillitis. Second type, that is acute follicular tonsillitis. In such a condition, there are also the crypts which are showing the purulent material filled along with the yellowish spots on the surface. Tonsils are distinguished along with the yellowish spots over them, and it is because of the purulent discharge which is filled inside the crypt of the tonsil. Third type, that is acute parenchymatous tonsillitis. Entire tonsil substance is affected. The whole tonsil become uniformly enlarged, red, and congested. The same is also occurred. The same could be also occurred to the adenoiditis. And in such a cases of chronic adenoiditis, there is difficult over the breathing, and majorly it is also causing the sleep apnea. In such a condition, adenoidectomy is the major requirement, and many a times it is also the immediate emergency surgical intervention which is required. In here, the stage 3, you could see that the both tonsils are very much enlarged, and that is also causing almost the dysphagia. The patient child could not eat or drink anything. Acute membranous tonsillitis, which is required to be differentiated with the diphtheria. In acute membranous condition, the exudation over the crypts, which is violent and coalescence, which is forming the continuous whitish membrane over the surface. So, starting from the posterior one third of the tongue to the larynx, it is showing the membranous structure, which is very similar to the diphtheria-like condition. So, membranous tonsillitis, that is having the abrupt onset, it is having the high local discomfort, exudative membrane easily wiped away, and defining the pyogenic organism. It is required to be differentiated with the diphtheria. In cases of diphtheria, it is diphtheria is comparatively slower onset with the high toxicity, and it isn't showing that much local discomfort, that the pain over the throat, discomfort over the throat. If in the cases of the tonsillitis, patient could also avoid any kind of the touch. They are not allowing anyone to touch their external throat as well. But in cases of the diphtheria, that local discomfort is absent. There is also dirty gray rather than the exudative whitish membranous characteristic. It is also differentiating, and the particular defining uh, uh, infection, that is Corynebacterium diphtheria. The third condition that is required to be differentiating, that is Vincent angina. It is insidious onset. There is also comparatively less feverish. In cases of tonsillitis, the high grade fever almost up to 103 degree Fahrenheit or 102 degree Fahrenheit along with the pain. But in case of Vincent angina, the local pain is also not there. It is along with the all over body. Membranous characteristic is that the easily removed, which will also reveal the irregular ulcer. So if the membrane is removed, it is showing the deeper ulceration. That is characteristic of the Vincent angina. There is also the infectious from the fusiform bacilli spirochetes. Infectious mononucleosis, that is residual. It is showing the marked discomfort, and the membrane characteristic is congested heavy membrane over the both tonsils. If the acute infection is remain untreated, it is causing the severe local and systemic complications. The local complications are like the peritonsillar abscess, that is particularly also known as quinsy. It is the abscess formation over the parapharyngeal fold of the tonsil. Also, it is complicated as the parapharyngeal abscess that is indicated over the particular area of the tonsil. The cervical abscess, that is jugulo-digastric suppuration. Cervical abscess is very navigated and cushioned over the tonsil. Acute otitis media could be also occurred. Many a times it is also occurred that adenitis is occurred after the tonsillitis. That the whenever if the particular tonsils are infected through the adenoid, and the adenoids are also very nearby to the eustachian tube, so it is also causing the through the eustachian tube, the infection could also cause up to the ear, and the middle ear could be also getting infected. That is acute otitis media could be also complicated in such a tonsillar infection. So that if the acute attack, sudden acute attack, that is incomplete resolution, it isn't resolute, and the pathogen or the debris are remained inside the tonsil. And further on, the fibrous tissue encapsulation that had occurred over that particular crypt, and inside that crypt, the trapped material which also causing more and more infection, and the discharge, purulent discharge will be encapsulated. Then further on, the recurrent acute attack, that is periodic flare up, could be triggered out from that particular crypt. If the tonsil is infected and that acute attack is not subside completely, if the tonsil is not came out from that particular acute infection, then further on such a vicious cycle could be possible, and then such vicious cycle is causing more and more recurrent infection, which will be leading to the chronic tonsillitis, and the tonsil could be also getting more inflamed. So the chronic follicular tonsillitis could be also result for the chronic parenchymatous tonsillitis or the chronic fibroid-like condition. In such a condition, that is chronic follicular tonsillitis, the crypts are packed with infected cheesy material presenting as the yellowish spot. Whenever such tonsils are getting squeezed from the dissecting forceps, it is also causing the squeezing and the discharge of those cheesy material. If it is resolved, but the tonsils are inflamed, then it is causing the massive hyperplasia of the tonsil. That is also known as kissing tonsil. In the massive hyperplasia of the lymphoid tonsil, tonsils are enlarged heavily, which is also meeting at the midline, which causing the thick speech dysphagia and the nocturnal sleep apnea. It may also causing the nocturnal sleep apnea. Nocturnal apnea means the patient will have the uh, loss of oxygen while sleeping, and the chronic fibroid, that is the scarring of the tissue, small infected tonsil, and the tonsils are physically small but deeply infected from repeated scarring. Pressure is required to applied over the anterior pillar to express the frank pus or the cheesy material. So the e- excretion or the discharge, which isn't quite characteristic like the chronic follicular tonsillitis, but the fibroid could be also occurred over such a condition. The dilated sign, that is the flushing of the anterior pillar compared to the rest of the pharyngeal mucosa, is highly reliable indicator of the chronic tonsillar infection. Surgical innervation is indicated when the tonsils are compromised or along with the airway or quality of life. Majorly, it is causing along with the more than 7 episodes in 1 year or the more than 5 episodes per year for 2 years. That is the criteria for the surgeons to cause the tonsillectomy. Peritonsillar abscess is also majorly indicated for the tonsillectomy whenever there is the second attack in the adults or 4 to 6 weeks post treatment in children. If it is causing the hypertrophy, causing the sleep apnea is the major condition which is harmful, and that is also majorly causing the tonsillectomy. Malignancy, if there is any suspicious or confirmed malignancy in the tonsil, then it must be removed immediately. Relative indication, there is diphtheria, chronic tonsillitis with unresponsive halitosis, recurrent streptococcal tonsillitis. In such all conditions, the tonsillectomies are suggested. So these all are the patient assessment which must be clear with the anatomical, systemic and hematological red flags. So in such all conditions, the tonsillectomy should not be performed. If the bleeding is significant, if the avoiding of surgery is required for the period of menses, if there is any bleeding disorder like leukemia, purpura or hemophilia, in cases of anatomical risk, when there is the overt of submucosal cleft palate, if there is any congenital anomaly. So all those are the red flags for the tonsillectomy. The dissection is achieved along with the majorly the tonsillectomy with the cold method. There are also the two methods, that is the hot and cold method. This is the cold method. In case of hot method, diathermy is used, but in cases of cold method, the preparation along with the general anesthesia, the patient is in the supine position with the uh, head high, lightly, neck extended via the sandbag under the shoulder and head stabilizer on a rig. That is the Boyle-Davis mouth gag, which is introduced and opened, held in the place by the Draffing's bipod. So these both are the bipods, which is causing the gag as open. So it is self-retaining retractor, which is causing the mouth is kept in open for the absolute visualization of the tonsils. So both tonsils are seen. Incision is made over the mucous membrane from where the starting of the anterior pillar is seen. Okay. So the palatine tonsil, as it is situated over the posterior oral cavity, the position is required to confirm if there is any variation. It should be also having a very nearby structure, that is the internal carotid artery is also very much nearby, passing almost from the lower portion 2 centimeter inside from the lower pole of the tonsil, as well as the glossopharyngeal nerve, which is also nearby to the tonsil. So the variation is must be understood, and then the incision is required to be made. Okay, palatoglossal and palatopharyngeal arches, which are within the palatine tonsil. So the palatoglossal arch, that is in front, and the palatopharyngeal arch is in behind of the palatine tonsil. The free medial surfaces of the tonsil is getting first squeezed if it is possible, and the pus is getting drained through that free medial surface, and then further on incision is performed, and the tonsil is grafted and dissected downwards to the lower pole. As we have discussed that the internal carotid is passing and it must not be cut. Glossopharyngeal nerve is also the another vulnerable structure which is required to be kept. So then further on, the tonsil are getting grafted, and then the snare loop is inserted. This wire-like structure is known as snare loop, or also known as snare only. So that is threaded over the tonsil onto its pedicle and tightened to cross the vessel and cut off. Okay, so it is tightened over the vessels as well as the pedicle of the tonsil, and then further on it is getting cut off through the snare. So that is the tonsillectomy. Alternative surgical methods that we have also discussed. The hot method, that is electrocautery, which will also reduce the blood loss, but it risks the thermal injury. There is also useful of the laser ablation. Laser is also used to remove that particular pedicle over the pedicle if the laser is rather than using the snare. Those both methods are also useful. Cold method, that we have just discussed. Okay, immediate recovery protocol is the first thing, is the positioning of the patient. Patient must be kept in the coma position, that is the lateral recovery position, until the fully recovery, to prevent the aspiration, as there is continuous bleeding and it could not be drained continuously. So the patient must be kept in the lateral recovery and head high. The patient must have the high head. Monitoring with the vital signs, evidence for the bleeding from the nose or mouth. Dietary as well as the oral hygiene is also required. Immediate, if there is any complication that is within an hour, that is immediate or primary hemorrhage, which could occur immediately after the operation, which is controlled immediately by the pressure ligation or electrocoagulation. Reactionary hemorrhage, which could occur within 24 hours, within a day. The such condition, the clot prevents the natural clipping action of the superior constrictor. After removal, the if after removal of the tonsil, the clamp is inserted over there, which is causing the superior constrictor muscle on the vessel. But if the clot remains over there, it will prevent such condition, and the hemorrhage will occur from that particular portion of artery or vein, that requires pressure on return to the theater for the ligation. So the ligation will cause removal of that particular clot, will stop that reactionary hemorrhage. Secondary hemorrhage or delayed hemorrhage caused by the local sepsis and premature separation of the healing membrane. That is managed. It is required to be managed with the clot removal or the antibiotic. So this is the one short video of the nasopharyngoscopy that I have just searched. These are adenoids. Through the nasal way, you could see the adenoids in between while entering over the nasopharynx. Okay. So just after the nasopharynx, while just over the oropharynx, you could see those structures which are known as adenoids. Those are also the useful lymphoid tissue to prevent any infection through the respiratory tract. So this is nasopharyngoscopy, which reveals the adenoiditis. In such inflamed adenoiditis, it is also required to see the uh, tonsils, if there is further on infection over the tonsils or not. So here you could see the oropharynx and all the structures through the oropharynx. Okay. In this video, it is along with the mouth gag again. So the patient has remained open the mouth along with the uh, palatine tonsil, which are seen over the bilateral. These both are the palatine tonsil, and again after 180-degree mirror, it is also showing the adenoid with the inner nerve. So this view is very much useful to confirm if there is any uh, infection or the any further on more infectious condition. This is the 180-degree view of the adenoid. It is because of the mouth gag. So that is the inner nerve. Okay. And in front of it, the small portion are the adenoids. This is the endoscopy after the adenoidectomy. The first nasopharyngeoscopy that we have seen, over which the adenoiditis is getting adenoids are removed and adenoidectomy, after which the part is looked like this. So it is almost clear, and in such a condition, the patient is also having very much breathlessness. Patient is having the difficult breathing, which is also relieved. But all those conditions are also getting recovered if it is treated homeopathically many a time. I am not suggesting that each and every time homeopathy will be also useful, or each and every time there is also requirement of the surgical intervention. But the both are simultaneously useful. The both things are also getting utilized for the patient's good health. The homeopathic paradigm, that is the restoration over the removal. Homeopathic normalized defense along with the conventional surgical loss of defense. Majorly, if the patient is getting tonsillectomy in the early stage, that is in the childhood, then they will also very much vulnerable for lifelong period. They do not have any kind of the immune system supporting over the entry of the respiratory as well as the gestation, or as well as the digestive tract. So the homeopathy normalized defense that will be much better rather than the conventional trap. That is the tonsillectomy, which will eliminate the symptom but the structurally removes the body's primarily antibody creator or the first line defense. There are therapeutic medicine as well as the other constitutional remedies, or all those which are indicated as per the totality of the symptom. Okay, I am just discussing few medicines. Those are very much indicated in the conditions of the tonsillitis. As the tonsillitis is the inflammatory response along with the majorly occurring over the throat. So the organ is throat pathological condition, that is the inflammatory as well as the infectious condition, which will be more and more utilizing such medicines like belladonna that is the dry heat profile the patient presented along with the red, inflamed, prominently swollen tonsil. There is also the particular sensation that is congestion, which is felt over the throat, along with the dry throat, fever, heat, and tightness as the distinct lump sensation in the throat. Patient could not swallowing. Swallowing is the highly difficult and uncomfortable, all along with the typical belladonna patient. That is useful to be considered. Second medicine, that is the Merck salt. Mercurius is also very much useful whenever there is a severe burning, smarting discomfort along with the pustular discharge, purulent discharge. That is majorly indicated for the Merck salt along with the white deposit, whitish or yellowish deposit over the tonsil with the bad odor from the mouth. There is also the excessive salivation and continuous urge to swallow. Third medicine, that is Hepar sulf. It is also useful for the suppuration, peritonsillar abscess, or such condition which is having the major infectious thing. After majorly the chronic tonsillitis, there is stitching pain, the splinter or thorn sensation in the throat. The pain which is also spreading up to the ear, as we have discussed, that it could also infection could be also spread upward up to the otitis media. Acute otitis media could be also occurred. In such a condition, Hepar sulf is also indicated. There is also the hoarseness of voice along with the yellowish mucus. Another one medicine that is also the best for the glands, that is Phytolacca decandra. It is indicated with the deep tissue inflammation along with heavily radiating to the ears. The pain is radiating to the ears. There is a roughness and intense burning sensation. The patient could not eat hot food. It will aggravating and swallowing causes the intense pain. Another two medicine, that is Merck iodatus rubrum and Merck iodatus flavum. These both medicines are also indicated, particularly the side-wise indication. Belladonna is also majorly indicated for the right-sided tonsillitis, and in the cases of the Merck iodatus flavus, it is also indicated to the right side of the uh, tonsil. And in the cases of the Merck iodatus flavus, there is thick, first persistent desire to swallow and the lump-like sensation, which is relieved by the drinking cold drink, cold fluid. That is Merck iodatus flavus. In cases of Merck iodatus rubrum, there, there is majorly indicated along with the left-sided tonsillitis with the dark red faces, and there is also the lump-like sensation which is distinct with the hawking up. Another two medicine, that is lachesis and lycopodium. In cases of lachesis, the bleeding could be occurred over the affected tonsil, and there is also the affinity for the progression from the left to right. There is constricted feeling over the throat. The tonsils are also getting discolored, purplish, and the pain is also getting spread to the ear. The trouble to swallow drink is characteristic to the lachesis, and the patient could not drink the hot liquid, which will aggravate the aching pain over the throat. Lycopodium is again indicated whenever the tonsillitis is affecting from right to left, along with the right tonsil with the ulcers and intense pain over the swallowing. There is also aggravation from the cold drink, and warm food and drink will be ameliorating. Calcarea carb is one of the medicine which is indicated with the typical fair, fatty, and flabby constitution. The patient is having the chronic tonsillitis, overweight. They also have the tendency to catch cold. Calcarea carb must be also differentiated with the silicea. In cases of silicea, there are rather than more infection for compared to the calcarea carb. Calcarea carb is almost nearby to the soric miasm. The additional utility that is highly useful for the post tonsillectomy symptom, that is post nasal catarrh and the cough. Baraita carb is also one of the best medicine for the chronic tonsillitis which is settling in the throat. The patient is also having the dwarfish constitution. There is delayed normal growth or development. It is also having the scrofulous diathesis, the physical dwarfishness. Patient also catches cold extremely quickly. So this all medicines, calcarea carb, baryta carb, silicea, all those are required to compare and differentiate with the smarting and stinging burning pain in the baryta carb. And the last but not the least medicine, that is tuberculinum. Tuberculinum medicine is also indicated in the cases with the tall, slender, very, very much developed child who are suffering from the cold. They are also the mentally active but physically weak. There is also the enlarged tonsil which are aggravated by the cold exposure and they have the aversion to the meat. Another two medicine, streptococcinum is the most effective for the eradicating persistent difficulty and diseases following a tonsillectomy. If there is persistent throat infection after the tonsillectomy, streptococcinum is also useful. Sulfur is also useful for the post-surgical focus with the residual or emerging problems after the tonsillectomy. Uh, So this is one of the flyer which is getting used by CCH or CCRH under the mother child or under the national campaign on homeopathy for mother and child care. Okay, so this national campaign is also almost, I think, in 2012 or 13, which is undergone along with the campaigning for the mother and child, in which the children are majorly suffering from the tonsillitis, and those are also supplemented with the homeopathic medicine. So those are the symptoms along with the medicine. Symptoms like the commencement of the acute attack of tonsillitis, throat pain, especially on the right side, difficulty swallowing, and dry tonsillitis. That is indicated for the belladonna. Severe splinter-like pain, throat extremely sensitive to touch, throat pain shoots into the ear when swallowing. That is indicated for Hepar sulf 30. 30 is the potency 30C. And ignacia is also indicated when there is a plug-like sensation, plug stuck in throat, and throat pain extending to the ear. Swallowing liquids is more painful than the swallowing solids. Very similar to the lachesis, but the ignacia is along with the plug-like sensation rather than the lachesis, which is indicated for the constrictive pain. Here there is the enlarged adenoids. So the adenoids which are situated posterior to the respiratory tract, tonsils which are situated. Okay. So those are the common sign and symptoms along with the causes and the do's and don'ts for the patients. Other medicines like the agrafines, Newtons, that is indicated when there is the obstruction to the nose due to the enlarged adenoids, adenoiditis. Child will breathe from the mouth like this. They will causing the open mouth breathing. Okay. Hydrastis is also indicated with the thick, sticky, yellowish nasal discharge, frequent desire to blow the nose. Calcarea force is also indicated for the pale, anemic, weak children who become irritable easily. Child has the cold extremities. That is the indication for the calphos. Okay, and I will have the one case in 2023. Uh, that is interesting, and we will just discuss it shortly. That is the
So, Viren,
Yes, madam.
We have only 3 minutes. Can you finish that case within 3 minutes?
Sure. Ma'am. So this is the case of a 3-year-old child which have the recurrent attack of the tonsillitis for 1 year, and episodes are consistently worsen over last 3 to 4 months. The mental generals, that is, the child came with the sad face, highly irritable. He is also obstinate that he does not want to even put out anything from his pocket, and that is typical condition for the obstinate thing. Physical general, as per the narration from the parents, mother likely, the extremely sensitive to the cold climate. Each and every time over the winter, there is aversion to the covering bathing, is likely to be constipated, but the aging, age-wise bedwetting, and dribbling of the offensive saliva. Particulars, that is, I have also tried to examine, and over the examination, he is showing the both tonsils are enlarged. So this is the first picture that I had taken. The child is showing, okay, both side is not seen that much clearly, but the both sides are inflamed, and it is also showing the typical inflamed tonsil. So after just a dose of Soranum 1M, he is getting it good, and over the third follow, it is almost clear, and they are very much like having the, okay. So very much thank you for all to listening patiently.
Thank you so much, Dr. Viren. You have explained tonsillitis with a detailed explanation and with the PPT sharing, even 3D animation, everything. It was a wonderful session for us. You have explained everything about tonsillitis with the homeopathic management, and at last, within a short period of time, you have presented your case even. Thank you so much for joining with us and sharing your knowledge here.
Thank
Thank you
Thank
very
you.
much. And come again with another topic.
Sure,
So
madam.
we can study more topics, right? Thank you
Yes.
so much for coming. Thank you all the participants of our English session for joining with us. And now we have to move to the Malayalam session. It is 9:30. So I'm handing over the session to Malayalam. Thank you once again, Dr. Viren, and thank you all the participants. Good night. See you the same time tomorrow. Thank you. Good night.
Thank you.
Thank you. Malayalam. Dr. Mariamma? Okay. So for moderating Malayalam session, I am inviting Dr. Mariamma John. Doctor, you're welcome, please.